Hello, happy people! Welcome back to another episode of 65 and Counting. I'm your host, Adam Frye. I'm a certified Medicare planner, and I'm here to ask the important questions that you want answered by industry professionals. This show is for everyone and anyone coming up on that important milestone of 65 years old. That means retirement, it means Medicare eligibility, or it means that you're just plain interested in the world of retirement planning. Whatever it is, on this show, you'll hear from the people that know it best. And I've got another great episode for you today. It's time to shine our educational spotlight on Medicare Advantage Plans. What are they? What do they do? What kinds of plans are available? And who benefits from them the most? But first, if you missed our workshops last week, online or in person, I've got some good news. There are still more in-person and online workshops this month. For a complete schedule, visit www.123easymedicare.com or give the office a call at 602-281-3898. And I'll include that information in the description of the episode. Also, American Retirement Advisors is working hard to prepare for the annual election period. No, not that election. It's almost time for AEP. And I'll get into detail about what that means and why it's so important. But if you're a current client of American Retirement Advisors, keep an eye out for some extra super duper important emails coming later this month or early next month. We'll also have a very special annual election period roundtable episode where all our advisors are going to come on the show and discuss the big changes for 2021. All right, that is enough housekeeping because we've got a lot of material to cover in this week's episode. Medicare Advantage Plans. What are they? Where do they come from? Medicare Advantage's roots trace back over 40 years. Medicare had offered managed care plans and managed care programs since the 70s, but they really didn't look like today's Medicare Advantage plans until 1997. That year, the government passed the Balanced Budget Act, which created Medicare Plus Choice. That's a program that the act created. And the name changed to Medicare Advantage in 2003, and enrollment in Medicare Advantage plans has been growing steadily since 2004. As of 2019, there were 22 million Americans enrolled in Medicare Advantage plans. That accounts for about 34% of all Medicare beneficiaries. And the federal government expects this number to grow to 24 million by the end of this year. So what exactly are Medicare Advantage plans? Medicare.gov says that they're a type of Medicare health plan that's offered by a private insurance company and contracts with Medicare to provide you all of your Part A and Part B benefits, but most Medicare Advantage plans also offer prescription drug coverage. And if you're enrolled in a Medicare Advantage plan, Medicare services are covered through a private insurance company's plan. Your Medicare services aren't paid for by Original Medicare anymore. Don't forget to check out our episode on Original Medicare from last month if you haven't already. Medicare Advantage plans, sometimes called Part C of Medicare, are a much more inclusive alternative to Original Medicare. Once you have your original Part A and Part B of Medicare, you can transfer those benefits over to a private insurance company and they'll take over as your insurance provider. If you join a Medicare Advantage plan, your bundled plan, Part A and your Part B benefits, and usually it'll have your Part D benefits included as well. Medicare Advantage plans cover all Medicare covered services. Most also offer extra coverage, which I'll get into later. There are a few different types of Medicare Advantage plans, such as HMOs, PPOs, PFFS plans, and special needs plans. And there's also HMO, POS, and MSA. That's a lot of letters. Now, for time's sake, this episode's only going to cover two of the more common Medicare Advantage plans, and that's HMOs and PPOs. Now, we call Medicare Advantage plans all-in-one plans around here. Why? Because typically you'll find that your plan covers your doctors and hospitals, but in most cases they'll also cover your prescription medications, dental, vision, and hearing. Some of them even give you credit to spend on over-the-counter pharmaceuticals and neat gadgets like Fitbits and Sonicares. So typically you'll find that you have copays and coinsurance for different medical services and medications, but fear not. Medicare Advantage plans are required to put a cap on your liability so you don't break the bank with maximum out-of-pockets, or we like to call them MOOPs, M-O-O-Ps. Maximum out-of-pockets are the most you'd be responsible to pay for medical expenses, excluding prescription drugs in a calendar year. In Las Vegas, I've seen them as low as $999, and they're regulated by the government, so they can't be higher than $6,700 in 2020 for in-network providers. Which brings me to my next point. Let's talk about networks, because they are an important part of Medicare Advantage plans. More often than not, with a Medicare Advantage plan, you'll find yourself making use of a plan's provider network. Now, most of these plans are geographically restricted by county. This means that the plan contracts with certain doctors, hospitals, and pharmacies to treat you. Typically, you'll need to seek medical services within these networks for plan coverage unless you need to use an emergency room or an urgent care, or if you have a PPO. Although with a PPO, you'll experience higher copays and higher coinsurances if you go out of network. Now, speaking of HMOs and PPOs, what are they? Let's start with an HMO. So HMO stands for Health Maintenance Organization, and they have their own network of doctors, hospitals, and other healthcare providers who have agreed to accept payment at a certain level for any services they provide. This allows the HMO to keep costs in check for its members. Since there's an agreed upon payment level, an HMO usually offers little to $0 in monthly premiums. That's right, $0 a month for most HMOs. And this is compared to other types of insurance plans. They also tend to have lower copays and lower coinsurance, which helps make them more affordable. HMOs are an affordable option for people who don't usually need anything more than basic medical care and an annual checkup or an immunization. Although due to network restrictions, out-of-network providers are not covered unless it's a true emergency. Now with an HMO, you choose a primary care physician from your network of providers when you sign on. This is the doctor that you see first when you need medical care. The PCP will have the best picture of your health and will be able to coordinate any additional care you may need. If you need to see a specialist first, you'd see your PCP. And if needed, they provide you with a referral to see one. Although there are some Medicare Advantage plans that allow you to see a specialist without having to go to your primary for a referral. So let's talk about PPOs now. PPOs stand for Preferred Provider Organizations. Now, a Medicare PPO plan is a type of Medicare Advantage plan offered by private insurance companies as well, but PPOs have networks and you'll pay less if you use the doctors and hospitals and other healthcare providers that belong to the PPO's network, and you'll end up paying more if you use providers outside of the network, but they're still covered. In most cases, you can get your healthcare from any doctor or any hospital you want. You have the flexibility to go to providers outside of the network at a higher cost. Additionally, most PPOs are going to have a monthly premium where HMOs run you about $0 a month. Some other fun facts about PPOs are that you don't need a primary care physician, and in most cases, you won't need a referral to see a specialist. Now, Medicare Advantage HMOs and PPOs are not the same as original Medicare or a Medicare supplement. They'll usually offer extra benefits not on original Medicare, but you may have to pay for these extra benefits. In most cases, HMOs and PPOs cover prescription drugs, and remember, if your Medicare Advantage plan covers prescription drugs, then you cannot buy a separate prescription drug plan. I've got a special episode about prescription drug plans coming up soon. Now, let's kind of change gears and talk about enrollment, because that's also a very important aspect of a Medicare Advantage plan. And there's some important dates regarding enrollment coming very soon. So if you're not yet 65 and you have no qualifying disabilities or circumstances, then you've got a 7-month window to enroll into Medicare and transfer those benefits over to a private insurance company, Medicare Advantage. Now that window starts 3 months prior to your 65th birth month. It goes through the month of your 65th birth month, and then it goes for 3 more months after your 65th birth month. And if you're already on a Medicare Advantage plan, or if you're on original Medicare and a Medicare supplement with a prescription drug plan, your time is coming to switch. October 15th through December 7th is the annual election period that I was discussing earlier, or AEP. And during that time, you can make changes to your coverage that will go into effect the first of the following year. So you can make a change anytime between October 15th and December 7th, and it'll start on January 1st of the following year. And I'm going to have more information on that in an episode coming soon. There's also some other special enrollment periods and open enrollment periods that I'll talk about in upcoming episodes. So all in all, if budget is important to you, Medicare Advantage could be the right way to go because they're more of a pay-as-you-go type plan. And remember that we always have certified Medicare planners standing by waiting to help. If you remember my episode about certified Medicare planners, you'll recall that they research all these Medicare Advantage plans for you in your area to help you find one that's got your doctors and your hospitals in network and your medications at the lowest cost on that prescription drug plan aspect of it. So that's Medicare Advantage plans. I'm going to get more into detail about different types of plans in coming episodes. We're going to take a look at special needs plans. We're going to take a look at different kinds of enrollment periods. And we'll get into more detail about those prescription drug plans. But thank you for tuning in. And don't forget to like this video and follow the page. And most importantly, share us with your friends and family. So tune in next week. I've got another very special episode for you. And as always, have a great week.